solution to a very complex issue. We are proud to be among a network of top-notch leaders in the field who are doing good work on behalf of our most vulnerable populations, many of whom are in this room. I want to thank Mayor Lightfoot for your leadership, your steadfast leadership during this unprecedented time in the pandemic crisis. We've never seen anything like this in our history. For the first time, in our city, we're seeing the issue of homelessness being dealt with on the level of urgency that recognizes it not as just a moral or financial imperative, but truly as a public health imperative for the first time. We are acknowledging how, as a nation, health and wellness of this vulnerable population is truly interlocked with our own. Today, what is happening on the front lines is truly transformative and is uniting the expertise of all the community subject matter experts working on this issue together and as one. In response to COVID-19, I am pleased to finally see the convergence of institutional healthcare experts, homeless experts, and government agencies. We are now working together to create the intentional integration of institutional healthcare with homeless and behavioral healthcare providers. We are now working side by side to provide the homeless with a seamless access to the appropriate level of care, housing, and discharge strategies that will no longer land them back on the streets. I know after this, there will be no going back to the old way of doing business. Our community-based residential behavioral health care solution, once overlooked by many, is now becoming a critical part of the emergency response infrastructure. It will create a new norm which will give the homeless access to the dignity and level of care they need. It will help prevent and overcome any of their sudden or chronic health, behavioral health, and economic and housing crisis situations. It is under Mayor Lightfoot's steadfast leadership that we are honored to be a part of and be a resource for this new delivery system. We could not have done this without the collaboration and support of the leadership from the Department of Health, Dr. Awadi, in particular Megan Cunningham, who's truly been a blessing. I think I speak for everyone when we say that she's been a blessing for the entire network for both health and homeless providers in listening